Hello everyone, welcome back to Let's Talk About It with Kelly. This is my husband John.
Hello.
He's the Trichologist at FREEDOMclinic Toronto. Today's topic is dandruff, seborrheic dermatitis, and psoriasis. It's going to be a great topic today.
I think so.
Okay, John, the first question is, what's the difference between dandruff, seborrheic dermatitis, and psoriasis? Because a lot of people get confused with the three of those. Can you explain?
Sure. And it's no wonder people get confused because it is actually much more complicated than it sounds. When we think of dandruff, we think of, little white flakes on the scalp. And that's basically what it is, or on the hair. When dandruff becomes really severe, it can point to a more intense problem like seborrheic dermatitis or psoriasis. So there is such a thing as a minor case of dandruff, which, although there's most likely an increased presence of a specific fungus on the scalp, there are other things that can influence it, like just a dry climate. A lot of people get more dandruff in the winter in Canadian and northern climates because, you've got your very low humidity and your heat on in your house, etc. Even, reactions to some products and coloring can dry out the scalp to the point where it might cause some flakes. And these can be referred to as simple dandruff. Mm-hmm. But yeah, seborrheic dermatitis is basically a more intense, it causes a more intense dandruff or flaking. Seborrheic dermatitis is a scalp condition that's mediated partially by the immune system, but basically your scalp is reacting to the presence of oil on your scalp. So your follicles produce this oil called sebum or sebaceous oil, and it covers the scalp. And some people's scalp react to it for some reason. It can cause this irritation, inflammation, itchiness, and this very nasty kind of scaling that turns yellow. And then you get this really high increased flaking and scaling. The other thing about seborrheic dermatitis that's important is that it can affect other areas of your body, mainly the face. But yes, any area of the body can technically be affected by seborrheic dermatitis. Mm-hmm. Now, psoriasis is even a more intense form. It's slightly different, but it's still autoimmune related. Scalp psoriasis tends to present just as very thick, heavy flakes, although some people do get this leathery patch of, heavy scaling and buildup on the scalp, like on the body. But most of the time in the scalp, it's a very thick, heavy scaling, silvery scaling. It doesn't tend to be oily. It's more dry. But these scales can pile up and cause an intense itchiness and discomfort where you're scratching your scalp and then it starts to bleed. So it creates this really bad cycle of itchiness and bleeding and severity. So they're all autoimmune. They're all related to this fungus on the scalp, but really they're definitely more intense versions of a very similar problem.
So they're all autoimmune, all three of those.
We may qualify simple dandruff, could be non-autoimmune, but often it is.
I see. Thanks, John. What is the biggest signs of someone's dandruff is actually something more serious like seborrheic dermatitis or psoriasis?
So, yes, especially with seborrheic dermatitis, there's going to be more symptoms that you will recognize. Itchiness, for one. You can have dandruff with very little itchiness. With seborrheic dermatitis, you'll almost always feel the itch, and it'll be a more intense itch. The scaling in seborrheic dermatitis tends to stick to the hair, whereas dandruff and flaking is often very dry and will fall onto your clothing, your shoulders, and you'll see it more on the outer areas of your hair, whereas the sebderm dandruff tends to stick closer to the scalp because it's an oily dandruff. It's caused by this presence of oil, which is affecting the scalp. Now, the other thing with seborrheic dermatitis is you're going to see more inflammation, and you might see it across the forehead. You might see it around the nose. It's more intense over the ears and at the back of the scalp, whereas simple dandruff is generally all over. So, yeah, those are the main things with seborrheic dermatitis. With psoriasis, a little harder to tell. It's more severe itching, more larger, more plentiful flakes. And again, this thing where you get so itchy and you scratch so hard that you cause bleeding is usually a sign of psoriasis rather than dandruff or seborrheic dermatitis.
Right. My next question is actually what causes dandruff?
Okay.
But you kind of answered that, I think.
A little bit. I mean, it's dandruff itself. We talked about how it's kind of a simpler form.
Right.
Or it can be a simpler form. But the one common thing with all of these conditions is the presence of this fungus called malassezia. And then that, of course, can trigger the immune system. And so it's the severity of this immune reaction to either the presence of the fungus or the sebaceous oil that's, bothering the person's scalp. So it's autoimmune reaction, different, extents. We don't know exactly why some people get it and other people's don't. So,
but it could be as simple as just a dirty scalp.
Yeah, if people aren't shampooing
dry.
enough, if you're if your scalp's a little bit oily and then you don't shampoo enough, then the oil can eventually turn into a seborrheic dermatitis for sure.
I see.
And people, if they just wash their hair, a lot of people, just shampoo more often, you might cure it. So now a loaded word, cure. We'll talk a little bit about that on a later question.
Is there any type of medication or anything that people can take for this autoimmune?
There are now new medications, oral medications for very severe cases. You've probably seen the ads on the TV for these new biologic medications that are coming out.
Right.
And some of them, Humira is one of them. That's a brand name for, psoriasis that is present throughout the body. These are very
severe cases,
severe cases only that use these. And, we're talking about scalp psoriasis. The only medication we usually will ever use really with scalp psoriasis and seborrheic dermatitis is topical steroid. There's a bunch of different ones that we'll use for different levels.
Right.
There are a couple of other, sometimes we need antifungal creams. But by and large, it's pretty easy to treat, except for when we get into severe cases of psoriasis. And that's when you need these medications.
Right. What about shampoos?
Yes.
Like our medicated shampoo.
Yeah, there's several different types of shampoos with medical ingredients in them that can be very helpful. And I think we're going to talk about that a little later.
Okay, perfect. Seborrheic dermatitis seems really common. What triggers flares up?
What triggers it or causes it to flare? And it's similar with psoriasis in some ways, but seborrheic dermatitis has some of its own uniqueness. We talked about how it's more mediated by the presence of these scalp oils that's causing this dermatitis on the scalp.
Right.
So anything that may increase the scalp oils, so not shampooing enough, stress can often do that. What else can trigger hormone imbalances? Can sometimes trigger excessive scalp oils, especially in women, but also in men. If you have a sensitivity in your scalp to oils, even, if you're sweating a lot, it might sort of trigger some of this dermatitis. So, if you tend to get inflamed scalp with dandruff, you want to shampoo and frequently and make sure that if you are sweating or your scalp's getting oily, that you shampoo right away. So, yeah, that's the best way to approach that.
So is that why it keeps coming back then?
It comes back because it's not really curable. So
I see.
if you say we find a great treatment and, we're monitoring your situation, you come back in a month and everything looks fantastic. Well, if you stop using that treatment, chances are the condition's going to come back because it's simply not curable in most cases. It doesn't cure it. It
could help it.
It's easily treated in most cases, but it's certainly not curable. Now, again, I say easily treated. More severe cases can be very difficult to treat.
Right. Psoriasis is often talked about as a skin condition. How does it specifically affect the scalp and hair health?
Okay, so that's a great question. With scalp psoriasis, we see less of these thick, leathery plaques on the skin. So with with body psoriasis, we don't really see typical flaking. We sometimes see this dry skin, white, scaly buildup, but that usually, on the skin, it can turn into this very leathery, hard, thick skin type of thing. And what's happening in psoriasis is your skin is actually proliferating at a much quicker rate than normal. So we have like these 30 layers of skin in the epidermis, and they constantly flake and replace themselves about every month or so. And the flakes are so small that we don't see them. In psoriasis, what happens is the immune system causes this rapid shedding of the skin, so that we're getting lots of flaking and we're getting lots of epidermis being released at the same time, as creating this layer on the scalp. And then what happens is if we scratch it, we peel it off, then we're exposing the dermis underneath, and it starts to bleed. Sorry, repeat your question again, because I got off topic there.
Psoriasis is often talked about as a skin condition. Right. How does it specifically affect the scalp and hair health, is the question.
So I just talked about how we get these real heavy buildups on the skin. We can get those in the scalp, and those are severe cases of psoriasis. If you get those in the scalp, then it's really quite possible that you're going to get hair shedding and hair loss. It's seldom permanent, but it can be, especially if you're getting these thick plaques and you're scratching it off your scalp. It's possible that you could scratch off hair follicles, including the all-important sebaceous glands and stem cells that are part of every follicular unit or hair follicle in your scalp. So if you scratch your scalp and you actually scrap it hard enough that you're removing that skin that holds those follicles, that can actually kill the follicle off.
Right.
Now, it certainly can cause hair shedding, and even severe cases or even moderate cases of seborrheic dermatitis can contribute to hair shedding. It can cause a telogen effluvium. This has to be mediated again by treatment. So yes, it can cause hair loss. It doesn't normally cause permanent hair loss. And in the scalp, with psoriasis, again, it would need to be fairly severe before it would cause any hair loss.
Right. Well, you kind of answered my next question, but let's just see.
Touch on it, yeah.
Can these conditions lead to hair loss, or is this a myth? So it's not a myth.
It's not a myth. They can lead to hair loss.
Right.
Excuse me.
If you scratch it and scratch out pull the hair follicle.
That would be a permanent type of hair loss, but in most cases, it's not permanent. If we get control of the condition, then the hair should grow back normally.
Okay, great. Thanks, John. A lot of people try drugstore shampoos first. What ingredients should they actually be looking for that work?
Sure, and there's certainly a lot of good drug store shampoos, and most dermatologists start with a product called Nizoral. I don't really like it that much. I mean, it does help and it does work in most cases. Mm-hmm. The issue with it is it's a very aggressive antifungal agent in it. It's called ketoconazole. And most people find that it dries out your hair and your scalp, and it doesn't leave it feeling particularly nice. So using it frequently is difficult. So Nizoral once a week, once every 2 weeks is normally what's recommended. Mm-hmm. The thing is, when you have, a case of even dandruff, seborrheic dermatitis, or psoriasis, you need to shampoo a lot more often than once a week.
Right.
So you want to bring other active ingredients in. So there's a few of them. So there are drugstore shampoos that contain, most drugstores have these. So they contain the selenium sulfide is a good antifungal that works well. We mentioned ketoconazole, but selenium sulfide you can use a little more often. Zinc perithione is an excellent agent as well in higher doses. And sometimes salicylic acid can be used to help reduce scaling. It can help remove scaling and reduce scaling. So those are the four main ones, but there are a number of other agents that may be helpful. But those are the most common ones that you'll find in drug shampoos, which is usually where people start. And they may be all you need.
Well, I'm going to take this opportunity to plug my own shampoo with our Freedom Medical line. We have a 2% zinc perithione medicated shampoo, and we have it in our clinic.
Yeah, and the advantage of that is it can be used frequently. because zinc pyrithione is the more gentle of the antifungals, but it works really well. So
And we have the 2% instead of the 1%.
yeah, so that makes it much more effective.
Right. Okay, so next question, John. What is the biggest mistake people make when trying to treat dandruff or scalp conditions at home? The biggest mistake.
I would say putting oils on your scalp.
We always come back to this.
Yeah, and not only that, so there's a few that are, that's one of the bigger, probably maybe bigger one is not shampooing enough. Because some people relate, they say, oh, it's the shampoo causing it, and it's generally not. Maybe the shampoo's not helping it much. But with the oils, the thing is, fungus feeds on oils. So some of these oils
That's a great point.
Yeah, and some of these oils may not be exacerbating the problem, but a lot of them probably are. And when I see people who use oils a lot on their scalp, regardless of what type they are,
Right.
and they're leaving them on for any length of time, they're generally making the problem worse because while it may soothe your scalp in some way, at the same time, it's causing the dandruff and flaking to stick to the scalp more.
Right.
And it's causing the oils to be, more, they're mixing in and they're staying there. So the more oil you put on your scalp, the harder it is to shampoo everything out. So if you're, putting oil on your scalp, regularly, then you're probably making it more difficult to clean your scalp. And this is one of the major problems.
That's a great point, John. Mm-hmm. A lot of people put that oil on and they think they're doing good. So you're hearing it here from the trichologist that is not good. Fungus feeds on oil and you're making your scalp worse. This is what I'm getting from what you're saying.
Yeah, pretty much. Now,
Okay.
We can qualify that a little bit. I mean, some people will put a little bit of, rosemary oil or what are the other popular ones?
Tea tree?
Tea tree oil, yes, things like that. And they'll find that, it's soothing, it's reducing their inflammation.
Yeah.
It might be possible. Mm-hmm. But again, usually when I look at the scalps, it's problematic.
In the microscope.
Yeah.
Okay, great. When should someone stop self-treating and come see a professional like a trichologist?
Well, it's probably worthwhile as soon as you see a little bit of dandruff and you get a little bit of itchiness. If you're not able to get that under control, you can go out and just buy a medicated shampoo and see if it helps. And if it doesn't, then you should go see someone. But, if you're getting any kind of severity where
it's consistent, right?
It's consistent, it's long lasting, and there's a lot of flakes.
Yeah.
And it's uncomfortable. You're getting any redness. If you see redness, mm-hmm. if you're getting really itchy, and you find your scalp scratching a lot, then you should probably see someone because it's probably a little more severe, and we got to get you on a good program and talk about your shampooing regimens and that sort of thing. So
and cleaning your scalp. So a good thing would be the head first treatments, right?
Yeah, so we do a number of these treatments in the clinic for different types of scalp conditions like psoriasis, sebderm, and simple dandruff. They all have different treatments. So yeah, those types of treatments in the clinic can really be helpful.
Okay, great. Thanks, John. For someone struggling with chronic scalp issues, what does the real treatment plan look like long term?
So with chronic scalp issues, and I was getting sort of to this earlier with the idea that, these conditions often aren't curable, so they become chronic. Mm-hmm. So if you have a chronic issue, it's probably, and it's always a problem, then it's because it's not being treated right.
Right.
So the process is, first to identify the problem properly and accurately so that that is best done with a scalp analysis. I mean, you can go, often you'll go into clinics and they'll look at your scalp for 30 seconds and then say it's this and that, and it might be, but it might not be. So we got to make sure we get the right products on board. So once we figure out the treatment process that works, it's usually has to be done for the long term, indefinitely.
Because it'll come back.
If we stop, it usually comes back. That's
right.
the
It's
problem.
unfortunate.
Yeah, it's unfortunate.
But at least if they're having treatment, it'll give them some kind of relief.
We can really mitigate these symptoms with the proper treatment protocol. And it's not a difficult thing. Most people don't have to come in every week or every month for treatments. Very severe cases, we have to bring on board some steroid creams and maybe more frequent treatments. And And, but often we can just control this with a change in the regimen, getting the proper products on board, and getting the frequency of shampooing correct. That probably is all you need in 70 to 80% of cases.
Wow, that's great. Thank you so much, John. This was a very interesting topic, and I think it's very common for a lot of people, and I think they got a lot out of this.
Well, I hope
episode.
so. And yeah, the important thing, like you mentioned earlier, is that if you start to see these signs and you don't know what it is, but it's bothering you, then, before you start putting, acids in the scalp and oils on the scalp and all these things, it's best to see a trichologist first so you can get the right treatment protocol for your condition.
Okay, great. Thank you, John.
Okay, thanks.
See you next time.
Bye-bye.
Bye.